Different provinces celebrated the births of several children on Christmas Day. Limpopo Health MEC Dr. Phophi Ramathuba has raised concerns about the number of underage mothers. MEC Ramathuba joins us now. MEC, good morning and thank you so much for joining us.
Morning, Kwena, and morning to all your viewers out there. And Merry Christmas to you and your viewers.
And a Merry Christmas to you too, Dr. Ramathuba. Thank you so much for that. I mean, as much as we're celebrating the number of children that were born on Christmas Day, there was a worrying, well, I guess, figure or number that said that one of the mothers that gave birth yesterday was a 15-year-old, MEC.
Yes, that's true. Out of the 209 deliveries that we received over the Christmas Day, 106 being boys and 103 being girls. We were so excited because all the babies and their mothers are in good condition. However, when we had to register a 50 number of teenage mothers, and while yes, majority will be those who are 18 and 19, but we are worried about a sizable numbers of those who are 16. And the main worry one was this one we've just mentioned of a 15-year-old who was actually the first baby that we received on Christmas at 12:05 midnight, was a 1.9 kilogram delivered by a 15-year-old mother. And that was a serious concern for us.
Now, MEC, looking at the figures and trends, I mean, this is not something new. If you go back to 2017, 2018, the number of children that were born to adolescent mothers, they went up to about 16,000 generally. So clearly there is a problem that needs to be nipped in the bud, as it were, of teenage pregnancy, not only in Limpopo, but in South Africa as a whole.
It is quite a serious challenge, and we've been raising this issue. And we need to categorize them into two. There are those who probably, like I've indicated, will be 18. Our wish is that they must remain at school before they start engaging themselves in sexual activity and focus on their education so that they can have a bright future. Those ones, in terms of the law, they are allowed to can engage in sexual activity. However, we keep on giving them sex education and educating them about the dangers of being pregnant at an early age and the danger of being a teenage mother, how difficult it is. But however, the crisis that we are currently facing is when you have got to deal with a 15-year-old. Last year, we were dealing with a 14-year-old who has given birth. And I remember raising this with the midwives and the counselors I was with on that particular day, that when you find a 14-year-old delivering or a 15-year-old, it means she fell pregnant while she was 13. And in my mind, when did she start to be violated sexually? Because the law does not allow anyone at that age to be engaging in sexual activity. That is clear definition of a statutory rape. And unfortunately, we still have got people within the community who continue to defend a statutory rape and come up with all sorts of excuses. If you open your line to listen, you would be shocked to hear some of the men calling and blaming government on us having to deal with somebody who is 15-year-old giving birth. Because one of the major challenges which we are facing as a province, and I'm not sure about other provinces, but I can tell you in our rural areas, when we open a case of statutory rape and call the police for the mother of that baby to be able to tell us who is the father, and when the father, irrespective of whether the father is underage or the father is above 20, and worse, when a father is 25 and you open a case, the parents of the girl child goes behind our back and withdraw that case and say the guy has paid damage, the guy has taken ownership of the pregnancy and the baby. Now, we need to to find the law that would then protect the children from their biological parents. Because here we are dealing with a crime. A crime is not the baby. The crime is the statutory rape that is evident by the fact that this girl child is giving birth in our hospital. So where we need to deal with its parents are causing us a lot of problems.
So also, I mean, one of the other things, MEC, it's a question of who is actually having sexual relations with these kids. Is it amongst themselves as young people or older people, as you mentioned, which eventually would be an issue of statutory rape? But, I mean, you and I would know that the province of Limpopo, also there's still so many issues of the issue of sex being taboo, questions that conversations are not being had properly, either at school, at homes, or so on. There's still people who I feel are very uncomfortable when government says, let's talk about condoms, let's talk about sex. So would you say that's part of the problem, MEC, that we still feel that the issue of sex is taboo?
It is part of the problem, actually a major problem. I called my colleagues who are working in the private sector yesterday to see, just share with me your experiences in terms of the age of the girls, that the mothers that you've assisted to deliver. None of them could report a teenage mother. Now, this is happening in public hospitals, and patients that visit our public hospitals are, for obvious reasons, using public schools. These are children of the working class parents. That is why you're quite right when you say it's a taboo amongst our own to sit down and have sexual education and talk about it. Even when I was sharing this with my mother yesterday, she was saying to me, you know, when we grew up, there were all these traditional and cultural activities that wherein girls are brought together and taught about these things by the elders at that time in preparing them to their motherhood or adulthood. They are being trained to say, when do you start to be sexually active? When you are matured, given the material conditions at that time. The boys were also given their own education, which is part of the passage towards manhood. That is why some of these things you would not necessarily see. Today we don't have those practices that we had culturally. Now, the Department of Education come up with policies to say, let's start to have these conversations at school. You hear even some of the men of God, the men, those who call themselves the men of cloth, our pastors and reverends, some of them will become very aggressive when we start with this topic to say, let's have sexual education being taught at even our schools and talk about it. Because once a girl child knows her body, knows the rights, knows the do's and don'ts, our children these days are more smarter. If we don't do it in a formal and guided way, they will use the television and social media. Unfortunately, they are rejecting it, and I think that's the only way as society must do. Find a way, because children, as I've indicated, in those private schools, you will never hear them being complaining of teenage pregnancy, because they've got parents, me and you, who can talk that language.
We understand that. MEC, unfortunately, we're out of time, but thank you so much for taking time to speak to us, MEC Phophi Ramathuba.